Radical belonging means creating and sustaining a supportive, enabling, and inclusive working environment for professionals from different socioeconomic backgrounds. The concept emphasizes the importance of eliminating hostility towards employees from marginalized populations. Radical belonging creates professional teams that meet healthcare workers' current and changing needs from minority groups. These include healthcare workers belonging to marginalized races, ethnicities, nationalities, religions, ages, and genders who are victims of discriminatory and working environments and practices. Through radical belonging, healthcare organizations can enhance cultures of diversity, inclusion, and equity through interprofessional learning and collaborative strategies. Belonging to healthcare teams enhances equity and fairness and fair treatment of professionals from minority populations. In healthcare teams, belonging enhances professional development and education among workers. The approach also supports learning and sharing ideas among professionals from diverse groups. Belonging encourages cultural sensitivity among healthcare teams. The approach requires workers to value cultural needs and differences among themselves and at personal and organizational levels. Okay, go next slide. Shared and democratic leadership styles will improve radical belonging at mHealth. This will encourage collective decision-making and learning among healthcare workers from different backgrounds. To build mutual trust among teams, a few strategies can be employed. One is integrating schedules for team building activities where the individual members are all engaged. These team building activities allow these members to understand each other outside their known patient care activities better. Restoration of justice policies at mHealth Fairview will also promote organizational level belonging. These will control the discrimination against minority workers at places of work by providing them with equal professional development, supportive working environments, as well as monetary and non-monetary benefits. Implementing radical belonging culture campaigns at mHealth Fairview will also enhance belonging at the organizational level. These campaigns will inspire the healthcare workers about the importance of diversity and inclusion at work.
So COVID has led to an increase in burnout in hospital staff, with healthcare workers being exhausted and having compassion fatigue. A sense of burnout can lead to decrease of sense of belonging. As mentioned in the different cases, the individuals of the team be more distracted, irritable, angry, no longer feeling safe in their work environment, as well as feelings of. For the impact of COVID, marginalized communities have had higher rates of underlying health conditions, lower levels of health insurance, increased risk for infection, and poor health outcomes. Older adults, especially those of racial descent, were severely impacted by COVID-19, with more than 95% of COVID-19 related deaths occurring in people aged 50 years and older. To address the gap of healthcare disparities among marginalized communities, especially considering COVID-19, our team has considered these actions of equal opportunity hiring, emphasizing diversity among teams, safe reporting of adverse events. It's important to address these healthcare disparities within the healthcare team, considering its impact on our patients. We should be encouraging opportunities to foster mutual trust and empathy within the team. Building respectful relationships within the healthcare team will further foster a better attitude and care towards patients of marginalized communities.
In order to implement radical processing, we need to have a plan in place in order to ensure that it is successful. Such steps in order to implement this plan would include equal opportunity hiring with a priority for gender and racial diversity, which would start from the top and work its way down. This should be vocally known from the top management and emphasized throughout the entire workforce. There should be an emphasis on diversity among teams so that isn't just diversity within certain sections of your organization, but within the organization as a whole, within every department and within every team that works under it. This would encourage the sharing of ideas, including the ideas of different groups, as well as reducing groupthink. We also need to create protocols for safe reporting of adverse events. When we create work environments that include people of different genders, races, and diversities, we need to have protocols in place that allow for the safe sharing of different views and different points. Such safety needs to be ensured, and we need to constantly be evaluating our processes to ensure that they are working correctly, which includes designating reporting personnel and encouraging constructive conversations for improvement. Next slide. A short and long-term roadmap to ensure that we implement this correctly would include short-term goals such as stated earlier, a top-down implementation which prioritizes of equal opportunity. So this involves people at the top of your organization encouraging racial and diverse groups and implementing that throughout. We need to develop equitable and inclusive position descriptions. We need to have descriptions of different positions be inclusive for all groups so that it doesn't only encourage one group over another in the hiring process. We need to have documentation of our recruitment goals, and we need to develop consistent and equal evaluation criteria so that everybody is evaluated on equal playing fields without any threat of bias. We also must have long-term roadmap to ensure that we are checking that all of our implementations are working accordingly. This includes quarterly or yearly metrics for hiring, team organizations, and performance. We need to be evaluating how our processes are working and if they're working correctly, and if we're meeting the goals that we stated that we attempt to achieve. We also should be evaluating those in-place processes and make sure that we are allowing for shared decision-making to drive future innovation. Next slide.
Leadership that involves an interprofessional team will allow for more diversity in the perspectives that are used for program development, program implementation, and program improvement. Overall, this allows for more targeted interventions that are more likely to take each group's specific obstacles and experiences into consideration. This also would lend to more effective programs because of the inclusion of different voices and taking into account what would be effective for each group. It's also always important to include the voices of those that are most affected by programs. Interprofessional involvement may also look like facilitating focus group discussions. This could be a component of the short and long-term roadmaps, as mentioned previously. So this would give groups the space to share their own experiences, ideas for next steps, and to discuss what they believe the key points for future programs to be. This also allows for more tailored interventions that are based on actual lived experiences. And then the groups can also later on be used to collect feedback and understand program impact as the programs are implemented. Leaders of the groups can also facilitate discussions within their own professional group because people may be more comfortable having certain discussions in that type of group. As well as interprofessional groups to allow for more conversation and support as needed. Interprofessional teams can also create an environment that overall supports innovation, communication, and support. Next slide, please.
Okay, so in order to implement all these plans that we have to have some metrics of success. So essentially, we're going to measure our success through a couple different metrics. There's two big groups that we're trying to hit. So certain diversity metrics and then certain inclusion metrics. So for the diversity metrics, first, we need to study the diversity of our current employees at Mo Health Fairview. And so it's important to, look at the data that we already have based off of the diversity of our staff from all different levels of the interprofessional teams. So that would be nurses, pharmacists, PT, OT, all of these different places. We need to look at the diversity that we have in these fields at the hospital. And then we need to study the diversity across all the different levels of positions, like we just talked about, to make sure that it is equal upon all those different places. As well, we need to strive for job quality, retention, and satisfaction for all these different races. So this is going to be a little bit different than just looking at the diversity of the employees. Essentially, what we're going to look at here is, okay, so these employees are diverse, but we see that maybe one certain population is not staying in the job for as long as another population. One certain population isn't as satisfied with the job as another population or race or ethnicity or group. Or maybe even the doctors aren't nearly as satisfied as the pharmacists are, making sure that everybody in each role is satisfied with within each specific like diversity group as well. And we can do this through surveys, maybe putting out surveys to the staff as frequently as possible. That's also going to be something that's pretty helpful. And then we also need to look at the inclusion metrics. So the inclusion metrics, one of the big things that we should look at is data on medication errors. Medication errors are a huge problem within the health systems, pretty much all health systems. And if we can look at medication errors, we can see kind of, okay, how would a certain interprofessional group be able to help this interaction? And if we look at those medication errors and we identify those groups, we can include those interprofessional professionals within the specific patient interactions to help them. Also, it's really important to make sure that the patients are satisfied. And so we could give the patient specific surveys. We do realize that we're probably not going to get full benefits from those patient surveys because not all patients are going to fill them out, but even giving them one upon discharge, asking them, hey, which providers were most helpful? Which provider did you not think that you saw enough of? Which provider could have helped you more? Sometimes these questions might give us answers that can help us figure out which providers need to be more involved within the patient. And then also ensuring that the patient is also very involved. One of the biggest aspects of patient-centered care is making sure that the patient is involved with the different providers as well. So overall, we need to look at the diversity metrics, which are the diverse population within each specific interprofessional profession. And then we need to look at the inclusion metrics and make sure that everyone is included.
And this idea is completely sustainable to all healthcare facilities and settings. Everyone should be able to have access to the data, and it should be looking at it and analyzing it to ensure that they have a diverse and equitable environment and recruiting process when hiring. Furthermore, they should look at the data regarding medication errors specifically and patient satisfaction, as Grant said, to see which providers need to be more involved in interprofessional teams.
So our next few slides are going to be talking a little bit about what we learned as a group, both from this case specifically, and then also about interprofessional teamwork more broadly. So in terms of this case, obviously we all had to learn a little bit about what radical belonging is and what that means, including its facets in social, academic, and democratic areas. A lot of the prior scholarship on what we now call radical belonging focused a lot on individual experiences and individual actions. But the current body of literature is moving much more toward this idea of community relationships and the idea that collective participation within a system is central to the collective well-being of that system. And so a lot of our sort of digging into this case focused on that idea and the shared responsibility for belonging and the shared responsibility for our workplace culture. We talk a lot about shared decision-making in the context of a patient-provider relationship. And this idea is sort of broadening that shared decision-making to who's designing our systems, who's evaluating our systems, and really redefining who is a quote-unquote expert in that area. And then we also, of course, learned a lot about the response to COVID-19 and its impact both on providers and on patients, particularly patients from marginalized communities, with a lot of the information that Stephanie shared about racial disparities in health outcomes, as well as the gaps in data on health equity and the areas that our scholarship is still lacking. And I think that article also highlighted a lot of the gaps in our ability to adequately monitor those health disparities, right? Because without the data, we aren't able to have a clear picture of what's happening to be able to address it. And so I think there's been a lot of discussion about our need for more long-term data collection in order to sort of bridge that gap.
And then lastly, we'll be talking about the effective teamwork. And as I was preparing for this presentation, I found this quote by Helen Keller stating, "Alone we can do so little, together we can do so much." And I thought it's kind of neat and kind of sum up everything that we've talked about. And from previous seminars and case studies, our team have concluded that there's 5 main elements of an effective teamwork. First of which being shared goal, and shared goal are essentially roadmaps that guiding the work of the team, and the team members should include the patients, family members involved, and all the healthcare personnel and healthcare workers. Individuals should all come together to have a discussion about their goals. And in the case of our case studies and the seminar, the goal needs to reflect the patients and the family priorities. The goal should also be clearly articulated, understood, and supported by all team members. And the second element is clear roles. And members of the healthcare teams often come from different backgrounds, having different sets of skills and knowledge. And for these reasons, it's very important that the team member develop like a deeper understanding of and respect for how discipline-specific roles and responsibility can be maximized to support the achievement of the team's shared goals. Also, since the roles of the teams can vary both professionally and also the professional function, it's also important that the patients and family members must be fully informed about these roles as well, so that everyone's on the same page. The third thing is mutual trust. Trust is also known as a current that flows through the team, and therefore it allows the team members to rely upon each other personally and professionally. And it also enables the most efficient delivery of healthcare services. Without trust, there's going to be less innovation, collaboration, critical thinking, and the productivity within the team. The fourth element is effective communication. And as we've learned from the first seminar, being able to provide an assertive communication rather than aggressive one will lead to a better outcome. On top of having an assertive communication, each member should also be able to be a good listener, being able to actively listen to the contributions of others that are on the team, including the patients and family. This will essentially establish an inclusive environment for the team, and therefore accomplishing their shared goals. And another aspect of effective communication is to have a closed loop type of communication, so that there's no confusion between members involved, and it's provide a clear set of goals and roles for those individuals. Lastly is reflection. At the end of healthcare services, we believe that team members involved should all come together and have a discussion about the work that's been done, including what were done good versus what could have done better, by providing each other's constructive criticism, so that they can learn from the mistakes and ensure better health outcome, better care in the future. Patients and families should also be included, as like Grant mentioned earlier, possibly through survey or filling forms at the end of their care that they've received, to see which part of the care are they satisfied and which part that can be done better and whatnot. And this concludes our presentation today.